Hello guys, so now we shall be discussing regarding the posterior triangle. Okay, so you know that the posterior triangle is different from the anterior triangle. We have discussed about the anterior triangle. Now within the posterior triangle there are two more triangles. One is called as the occipital triangle, another one is called as the supraclavicular triangle. Okay, so what is this occipital triangle, what is this supraclavicular triangle, right? How it is different from the anterior triangle, what is the muscle that is separating anterior triangle of the neck from the posterior triangle of the neck, we shall discuss right now. Okay, so first of all let me draw one picture showing you the lateral surface of the face over here. So here, so this particular bone which I have drawn here is called as a mastoid bone, and next this is the temporal bone. From the temporal bone you see a spinous process. This is called as a spinous process or the styloid process of your temporal bone. Just in front of that you have got, what is this? This is your mandible, right? This is your coronoid process and this is the head of the mandible, right? So I hope you know these structures over here. And this particular structure over here is your mandible, like this. Okay, so this is your mandible. This is your mandible over here, right? Now just beneath the mandible you have got another important bone. Just beneath the mandible you have got another important bone, and that bone over here is called as your hyoid bone. So this is your hyoid bone. Okay, and next just beneath your hyoid bone you have got a next important bone like this. This particular bone over here is called as your thyroid cartilage, and beneath the thyroid cartilage you have got a structure called as your cricoid bone. Okay, now beneath the cricoid what is the structure? See, if this is your thyroid, this is your cricoid, and down here you have got sternum, right? So here you have got another bone like this. This is your sternum, and attached to the sternum you have got what? Attached to the sternum you have got your clavicle. This is your clavicle. Okay, now if we draw the midline over here, this is the midline of the neck. Okay, so all of you know that this is the posterior surface on the back, yes or no? So this would be the posterior surface here. This would be the posterior surface. Okay, let us not draw this thing and make the picture awkward. So I hope you understood what are the structures which you have drawn, right? So let me draw the neck here. So this represents your neck. Okay, now what are some of the important things which you need to know over here? The first important muscle, and by the way write it down, that this is your mastoid bone. This is your mastoid bone, which is very important right now. And this one over here is your hyoid bone, and this is your thyroid cartilage. Okay, and here down we have got the cricoid, and you know that this is your sternum down, as well as another one is clavicle. Let me write it down. This is your clavicle and this is your sternum as well as the clavicle. Okay, now let us draw one very important muscle. Now this muscle starts all the way from the mastoid bone and comes down till, see, from the mastoid process it is starting, and this muscle is coming down all the way till here. Right here what do we have? We have got clavicle, we have got sternum. So this muscle comes all the way down and attaches to the clavicle and sternum. So this muscle is called as sternoclavicular muscle, right? Sternocleidomastoid muscle. Why it is called sterno? Because it is attached to sternum. Why it is called cleido? Because it is attached to the clavicle. And why it is called mastoid? Because all the way it is going and attaching to your mastoid. So sternocleidomastoid muscle, right? So that muscle over here, you look right now. So this particular muscle which you can see here, which I am drawing right now, okay, so this particular muscle is called as your sternocleidomastoid muscle, right? You see this? Yeah, you see this muscle? This particular muscle is called as your sternocleidomastoid muscle. Now after discussing sternocleidomastoid, you should also discuss one more muscle, that here actually that muscle is present. Look here. So let me draw the borders of sternocleidomastoid a little bit thicker. Right. Now if you look at the mandible over here, here you have got one more muscle like this. You see? See, this particular muscle which you can see over here is called as your digastric muscle. And the next important thing you need to know here is that here we have got this particular ring, right? So this digastric muscle enters into this ring particularly and comes out of this ring. So this is a tendinous ring that is located on the hyoid bone. So this digastric muscle all the way goes and attaches here. All the way it goes and attaches over here, right? So this muscle over here is called as your digastric muscle. So this muscle over here is called as your digastric muscle, like this. Okay. So one is called as the anterior belly of digastric muscle and the other one is called as a posterior belly of your digastric muscle. Okay. So this muscle over here is called as the anterior belly of digastric and this is called as your posterior belly of your digastric. And this muscle over here is called as your sternocleidomastoid muscle. Okay. Right. Next important thing is that all the way from the hyoid bone, right, down here you have got one very important muscle and this muscle over here is called as your mylohyoid muscle, right. Next important thing is that on the back side also you come across one more important muscle, right. You see this muscle which is coming on the back, right. So this muscle on the back side which is coming all the way down, right. So this muscle is called as your what? This is called as your trapezius muscle. Okay, so this particular muscle is called as your trapezius muscle. Right, so this is your trapezius muscle. So what is the name of this muscle? So this muscle is your trapezius. Okay, so this muscle over here is your trapezius. Now here whatever triangle you can see, right, actually there are a few important triangles. Let me mention those triangles right now. So let me draw one more muscle over here, right. So anyways let me mention some very important triangles over here. Now in front of the sternocleidomastoid muscle you see this entire triangle, you see this particular triangle over here in front of the sternocleidomastoid muscle, right. So all the way from here till the midline of your neck like this. So this is called anterior triangle. And after that here you see another triangle like this. This is called as a posterior triangle. Okay, anterior and posterior. So anterior to what? Anterior to sternocleidomastoid muscle is anterior triangle. And posterior to sternocleidomastoid or back of sternocleidomastoid, whatever we have, that is called as your posterior triangle. Now within the anterior triangle here, you see this particular yellow color shade, whatever I am giving over here, right. So this particular yellow color shade, whatever I am giving over here, this triangle is called as your carotid triangle. Okay, so what is the name of this triangle? This is called as your carotid triangle. Okay, now after the carotid triangle is done, you come across another triangle that is located just beneath your mandible here. You see, this particular triangle is called as submandibular triangle. So this is called as submandibular triangle. Okay, now after this submandibular triangle you come across a third important triangle. So what is this third important triangle? Look here. So this is the third important triangle which you can see. Where is this located? This is located above the hyoid bone and beneath the mandible. But which part of the mandible? See, this part of the mandible is called as the mental region, mental part of the mandible. So this triangle is located beneath the mental part. So that is why this triangle is called as submental triangle. Submental triangle. So within the anterior triangle of the neck, how many sub triangles are there? One is called as a carotid triangle, another one is called as a submandibular triangle, and the third one is called as a submental triangle. There are three triangles located in the anterior side of your neck. Now when it comes to the posterior side, this entire triangle, it looks as if it is a single triangle, right? But actually there are two triangles over here. What did I tell you? Posterior triangle, right? Posterior to sternocleidomastoid muscle, there will be two triangles. Okay, what are those two triangles? One is called as occipital triangle, another one is called as your supraclavicular triangle. So how do you divide? I divide it like this. You see there is a muscle which I am drawing right now, right? So the name of this particular muscle is your omohyoid muscle. Okay, so what is the name of this muscle? This is your omohyoid muscle. Now when I tell omohyoid muscle is having two bellies. One is called superior belly, another one is called inferior belly. So this is called as the inferior belly of omohyoid muscle. Okay. So this particular belly over here is called as your inferior belly of omohyoid muscle. So can I tell inferior belly of omohyoid muscle is dividing the occipital triangle into two more triangles. So the triangle that is present above the omohyoid muscle is called as the occipital triangle, and the triangle that is present below the omohyoid muscle and it is present above the clavicle. So you can call this triangle as your supraclavicular triangle. Okay. Right. First of all, let us start discussing about the floor. Okay. In the floor, we have got few important muscles. For example, here we have got one muscle and this is the second muscle over here, and here we have got next important muscle like this. Okay. Here as well as here. Okay. Now, when I draw these things, you will understand. So, what are these triangles over here? The first important triangle is, see here, I am shading one very important thing, right? You see this particular muscle, whatever I am shading here. So, these are the muscles, whatever muscles I am writing here, these form the floor of your occipital triangle, okay? So, this muscle is called as semispinalis capitis. I will write it down later. So, this muscle is called as your semispinalis capitis. After that semispinalis capitis, below here you have got one more muscle, you see. This muscle over here is called as splenius capitis. Okay, this muscle over here is called as your splenius capitis. And after that, you see one more muscle here. This muscle over here is called as your levator scapulae. So this muscle is called as your levator scapulae. After levator scapulae, the next muscle which you have over here is your scalene muscle. You know, you have got three different types of scalene muscle: anterior scalene, middle scalene and posterior scalene. So this particular scalene muscle, whatever you can see here, right, so which is above and below the omohyoid muscle. So this particular scalene muscle over here is called as your medial scalene, okay, or scalenus medius. So this muscle is your scalenus medius. Okay. Now after this scalenus medius, the next last muscle which we have over here, this is called as your serratus anterior muscle. Okay. So this particular muscle which you can see over here is called as your serratus anterior muscle. So this particular muscle is your serratus anterior muscle. Okay. So let us write down what are the names of each and every muscle which is located in the posterior triangle. So one muscle, this one, what do you call? This is called as semispinalis capitis. This is called as your semispinalis capitis. Next, this muscle over here is called as your splenius capitis, semispinalis capitis, and this is your splenius capitis. And this muscle over here is called as your levator scapulae. This is called as your levator scapulae. Now, after levator scapulae, the next muscle which you have over here is scalenus medius. So, this is called as your scalenus medius. Okay. Now, after this scalenus medius, the next important muscle which you have over here is called as your serratus anterior. Serratus anterior muscle. So, these are the muscles which form the floor of your occipital triangle, right, or the posterior triangle. So, what is the muscle that is dividing the posterior triangle into two more triangles? That is the inferior belly of your omohyoid muscle. Okay. Now, let us see what are the contents here. What are the contents are? First important content is that you see here there are 1, 2 and 3. There are 3 structures over here. You know what are these 3 structures? These 3 structures are called as the trunks of brachial plexus. You know, in the brachial plexus you have got roots, trunks, right, divisions. So these are called as the trunks of the brachial plexus. Now just beneath the trunk of the brachial plexus, here you have got one more artery. Okay, so this particular artery which is located beneath the trunks of your, so this artery over here which you can see is called as your subclavian artery. Okay, so there are 2 important things. So these 3 over here are called as your trunks of brachial plexus, trunks of your brachial plexus, and this particular artery which you can see over here is called as your subclavian artery. Subclavian artery. Okay. Now after that you have got one vein also. Okay, so you see this important vein which I am drawing right now. See this particular vein which I'll be drawing right now, right? You see this vein is called as internal jugular vein. And where is this internal jugular vein draining? There is one more vein over here into which this internal jugular vein is draining, and this vein is called as your subclavian vein. Okay, so here what are the important things? So this vein over here is called as internal jugular vein, and internal jugular vein is draining into another vein that is called as your subclavian vein. Subclavian vein. Okay, now along with this name there should be some nerve also. You see this green color line which I am drawing now, this will represent the nerve. So what is the nerve that is present here? These are called as your phrenic nerves. These are called as your phrenic nerves. Okay, so if I ask you what are the contents of the clavicular triangle, you see this triangle, this particular triangle is called as your supraclavicular triangle. So it is having what are the contents? One is the trunks of the brachial plexus, next is the subclavian artery, right? Next you have got is a subclavian vein, internal jugular vein, as well as the phrenic nerve. So these are the structures that are located where they are located within your occipital triangle, right? So this is what we discussed so far. We discussed that occipital posterior triangle, posterior region of your neck is having two important triangles. Okay, one is called as your occipital triangle, okay, and the other one is called as your supraclavicular triangle. Supraclavicular triangle, occipital triangle and supraclavicular triangle. So these are the two important triangles that you basically have over here. Okay, so I hope this makes sense, right? And this is all you need to know regarding the posterior region of the neck. Thank you so much for watching my video. Goodbye.